Hi, this is Larry Bauer, Chief Executive Officer of the Family Medicine Education Consortium, and I'm talking today with Dr. Robert Motley and Mr. Garrett O'Dwyer, who are based in Philadelphia. Dr. Motley is the Vice Chair of Community Medicine in the Department of Family Medicine at Jefferson University in Philadelphia, and Mr. O'Dwyer is Health Program Manager for the Philadelphia Association of Community Development Corporation, or the PACDC. I was talking a few days ago with Dr. Motley, and he was telling me how the community-wide, it's coming together in Philadelphia to respond to the COVID crisis that's coming up. And I thought what he had to say is something that other communities would be interested in learning about. So, Dr. Motley, I'm going to turn things over to you and ask that you begin the conversation.
Thanks, Larry. It's interesting, the signal that we might have a problem with the understanding at the community level actually came from a couple of my children who live in Philadelphia, as well as some clinical encounters where it was becoming clear the disconnect between the individual understanding of what they needed to do to help themselves, but an awareness of how contagious COVID is at the community level, and the need to make everyone aware that we have a role in stopping the spread. In terms of figuring out how we might approach that problem, got thinking of strategies to get the word out from and get it to the front lines within neighborhoods, with that voice being a trusted voice, that of a peer or someone who has a reputation for being helpful in the community, as opposed to the glut right now of public health information that's out there that's accessible. So this was really a strategy around behavior change and education, try to motivate. So I reached out to Garrett O'Dwyer. He works in an organization that has deep roots within communities at the front lines. And we had a conversation to kind of brainstorm what might be possible. And the idea kind of took root. So with that, I'm going to invite Garrett to give his perspective and sort of how he recommended next steps.
Yeah, sure. And I guess I would start by just taking a step back and familiarizing folks with community development corporations, or CDCs, very different from the CDC that I'm assuming most of you work with. And so community development corporations are neighborhood-based organizations that really engage in the full range of work that you might think of when you think of neighborhood revitalization or neighborhood stabilization. So they build affordable housing, some even build market rate housing. They stabilize vacant properties. They're involved in economic development and creating new community spaces, whether green spaces or parks or other community amenities. They manage neighborhood shopping districts, and they also provide social services. Some have moved into education and direct healthcare provision through clinics. Not every CDC does all of these things, but this is generally what the sector as a whole does. And this isn't unique to Philadelphia. CDCs operate in every city around the country. Sometimes they don't necessarily call themselves a CDC, but it's the same essential work. And so what we do is we're the umbrella organization of CDCs in Philadelphia and work on behalf of them, as well as the communities that they serve, to make sure that the policies are in place that allow the programs that they use to work well and be well funded, as well as to make sure that the residents of those communities are supported. And a part of that involves working with health institutions as well. And so we've partnered with a number of health institutions throughout Philadelphia, including Jefferson Hospital. And so we have about 65 CDC members within Philadelphia, within the city itself. We're our list of different neighborhood organizations extends well beyond that. And so when social distancing started to take place and folks started to work from home and there was significant disruption both for our organizations and the folks that they serve, we immediately jumped into gear trying to think of ways that we could help both our members navigate this as well as get information out to the neighborhoods that would be helpful, whether that's in, small businesses and grants that have become available to help them weather the storm, or other information that's really critical at this time. And so when Dr. Motley approached me around getting information around COVID out and the need to both get up-to-date information out in a way that is acceptable to the community and accepted by folks in the community, and also combat misinformation, it seemed like a real dovetailing of interests. And so the first thing that we thought necessary was to convene a focus group of about 10 different neighborhood organizations, CDCs, and get a sense of, number one, is what we've been hearing both on a national level and other places, but also the anecdotes that Dr. Motley was referring to, is that the same thing that they are seeing on the ground? And then what is the best way that we can work to assist them in getting information out there and best practices to be able to combat community spread of the coronavirus before, so the next few weeks, which are going to be really critical. Anything to add before I talk about the results of that focus group, Bob?
Just that I think many physicians do have connections, particularly between primary care and the community, and that what I call the clinic to community connection is important both for the ongoing work, particularly within needs assessments within communities. It helps inform areas with regard to screening and education as well as access. So the fact that these relationships exist has made it easier to make this go a little bit faster.
Yeah. And I think that, another important thing to point out is that we didn't just simply go it alone. We did reach out to the local health department. We also got involvement from the Healthcare Improvement Foundation, which is a local entity that has good relationships with all the different health actors. So we wanted to make sure that, while we were really interested in having an additive role, we weren't trying to work at cross purposes or duplicating efforts or certainly adding to any kind of message confusion that was out there. And thankfully, when we did reach out to the health department and any other agencies that we've talked to, this has definitely been a very welcome development, because this is actually not a lot of what they do. And so getting this kind of information rapidly out to the community through trusted sources wasn't something that they were in a good position and really prepared to do. So they were pretty excited that we were beginning to work in this way.
So I'm curious, Jared, what you
Sure.
learned when you held your focus group session.
Yeah, so there are 4 different key areas if we distilled it down. That and these are in no particular order, I don't think. Well, the first one I think is really probably important, but is more important. But we did hear that basically what the anecdotes that Dr. Motley described and what we've been hearing on the news from other places is consistent with what our folks have been seeing and hearing on the ground. A lack of adherence to the protocols being recommended, a confusion about what the protocols were or why they were. So you'd have people say wearing gloves but touching their face with gloves because they assumed that all they had to do was protect their hands, which obviously is not the case. So there was some confusion there, deep suspicion and misgiving about this being a hoax or no big deal or something like that. So that was really validated, and the need to get this out and not just get information out, but get information out in a way that was simple and clear and people could understand, and that was also sensitive to the different linguistic communities. Just in South Philly alone, I think there are about 28 different Asian dialects spoken. So the making sure that materials that are generated are appropriate for the audience that's receiving them is really important. But one crucial thing was that young people, so say younger than 21, were not really taking this seriously, and didn't see it as something that really pertained to them. And so we've been working on different strategies for addressing that, and how can we, use new media like social media and so forth to be able to actually get information out in a way that would be meaningful to that audience. We're going to be convening a focus group of just young people to kind of guide us in how best to do that. And Jefferson also has a relationship with one of the big sports teams here, the Sixers, and so they've done some outreach to see whether there might be some way to get some sort of PSA messaging that could appeal to that audience. The second was the need for posters and other materials that had that clarity and came from a source that folks could trust, developing them and getting them out. The third was around guidelines and protocols and talking points for organizations that are still providing social services. So say they're distributing food, how should they be setting up their food distribution to make sure that both the volunteers understand what proper protocols on this are, as well as the folks standing in line, that this is an opportunity to really get more information out to folks. And then also the just talking points to make sure that these kind of community connectors, whether they're doing it in person in that situation I just described, or over the telephone, we have a number of organizations that are checking in on seniors and others to make sure that they have talking points that they can use to share relevant, up-to-date information. And then lastly was around combating discrimination, acts of violence, and intimidation against the Asian and Pacific Islander community, which we've seen an uptick in these kind of bigoted acts against our neighbors, as have a number of communities across the country.
So I think that the listeners, along with myself, have seen on TV the young folks, whether they're students or not, frolicking in Florida on the beach, in bars and whatnot, not taking the message seriously, just totally kind of oblivious to the threat and how they could contribute to the death of their grandparents. So I'm excited to hear that the team that you're putting together is figuring out how to address folks who are probably very similar in background, culture, et cetera, who have stayed in place in your city, so that hopefully Philadelphia won't become the hotspot like New York City has become. Comment on that?
Yeah, no, I think that that's exactly right. I mean, I think that we're looking at what's happening in other places and seeing that as a cautionary tale, and want to work to do what we can to prevent that here. And a part of that is not only utilizing these networks to get the information out. So I believe every community has these kind of networks of social service providers and neighborhood groups. Because I would be remiss if I didn't stress that it's not just the CDCs that have these, high capacity $1 million budgets that we're relying on for this. It's also smaller neighborhood advisory committees, as well as, different neighborhood zoning committees, which really have no budget, but are really good at disseminating information. So we're really trying to leverage the broader civic network to get information out. But then, so that's one part. Then the other part is around messaging, making sure that the messaging is meeting people where they are socioeconomically, culturally, et cetera, and really is tempered to the audience so that it can hopefully be more effective. And I guess we'll see how effective it can be.
I realize that this is very much a work in progress, and there probably isn't much in the way of results, but I'll just ask the question. Are you seeing any progress in growing impact of your work?
I think at this point, it's probably a little too early to tell. We have been very focused on trying to push out components of this that are most likely to be able to be deployed quickly. The youth project is still in the process of identifying groups that can have the right adult support and IT support. I think what we're likely to get deployed is having those in the community development corporations around the city use both email blasts as well as personal phone calls in a phone chain, if you will, and have some talking points as supported by some printed materials that can get around. So this is against the backdrop where I think, week to week, I think people are getting a little more concerned looking at the situation in New York. And so, we may get a boost, from that increased awareness. And I think a little bit of fear is okay, but hearing from a trusted source or a peer, that's most likely to motivate people to maybe do the right thing and do it for the broader, community. As you said, personalizing, think about your mother, or your grandmother, your father, and I think that's a good recipe. We want to keep tracking of who we're reaching very simple. People are super busy right now. And so we've talked about just having a simple tick sheet, perhaps for those at the front lines as they make their calls and send their email blast. How many did they get out? And I think it'll remain to be seen, whether we can infer some benefit in awareness. I think clinicians themselves, it would be wise to just sort of pause for those that they're counseling in a clinical setting about COVID and inquire about that patient's attitude and maybe from a public health perspective, because I think there's still a disconnect there as well. Patients want to do the right thing for them and maybe those in their household, but making them mindful of trips to the store or going outdoors, whether they're feeling well or not, and using things like a mask to try to protect themselves, as well as for those who may have some symptoms, getting them to stay at home.
So,
and I would
go ahead.
I would just add that briefly that I think that it's been really encouraging that as we have been doing this outreach and broadening the sphere of people to make sure everyone's kind of rowing in the same direction in terms of the outreach they're doing and messaging and communication. There's just been an overwhelming, interest and support for this from the different the different folks that we've communicated with. So I think that this is really, that sort of demonstrated that it's effectively filling a gap that was there on an organizational level.
So, Dr. Motley, have you talked with any of the other departments of family medicine or the family medicine residency programs in the Philadelphia area about this?
So at this point, Larry, we're really trying to gear up and stay very focused on operational execution. This call, in part, I hope, can help to get the word out. And I think as we interface both with other folks within our own organizations and have the opportunity to then communicate this, I have thought about how we might develop a communication plan to roll this out to both inform other sponsors within our own institutions, as well as try to scale out the message. Clinicians are frightfully busy. For those who are involved in education or research, they are being pulled in to clinical roles. And so It's going to be a little bit about how do we balance the bandwidth in allowing this. I'll just speak for myself. This is something I felt like I could do, and I had the opportunity to collaborate, which makes it a little easier to work on a weekend beyond my clinical hours, because we have an opportunity here upstream, if you will, and a big lever that can save both our primary care clinicians as well as our hospital colleagues. And I think everything that we can do at this point with this pandemic is worth giving it a shot if people are willing to invest a little time.
So on behalf of the FMEC, what I will do is I will contact the other chairs of departments and the residency directors in the Philadelphia area. I'll share the link to this recording with them so that they can listen in. And if it's okay with you, I'll offer your email address if they want to reach out. For all I know, they're doing similar kinds of things within their network of contacts. And I think it would be good to be aware of what one another is doing so that there's not duplication of effort.
That's a great point. And I know that the department chairs have their own listserv. And so that's probably a good place for sharing what's going on. And then those chairs can connect those involved directly with the work.
Okay. So are there any other points that you'd like to bring forward at this time?
I think from my perspective is everybody can do something. You know, maybe this is not something that our audience is able to do, but everybody can do something, and it's gratifying to see how duties are being split up. So whether it's operating telehealth platforms, working in the hospital, getting the word out into the community, it all matters. And I think people should feel good, even though we're working hard right now, that this is going to pass. And if we work together, I think we can help do our best in terms of creating the conditions for health.
And from a community standpoint, I think that there are groups on the ground doing work that want to help with this. They can help in getting information out, raising awareness, etc. But they don't necessarily know what to do, and might not be inclined to just go and do anything on their own. So I think that there's really this untapped reserve in a lot of places that with just a little bit of effort, you can really get folks together.
Great. Well, I thank you both for talking with me today. Is it okay if I have your email addresses when I send this message out? So if people want to reach out and communicate with you, that would be okay?
Absolutely.
I agree.
Great. So thank you very much, and stay safe.
You as well.
Thanks so much.